Good afternoon, everyone, and thank you for joining us and supporting the Professional Care Workers Week. My name's Martin Jones. I'm the CEO of Homestead, and I'll be acting as chair for this panel discussion. And the discussion will last up approximately 3/4 of an hour, up to an hour maximum, where we're going to be discussing the important issues our workforce have and challenges. And by different settings, we've got an esteemed group of panelists with me today in terms of to introduce themselves. So I'll kick off with Avnish, a bit about himself, and then take the next panelist. Over to you, Avnish.
Thanks, Martin. I'm Avnish Goyal, chair of Hallmark Care Homes, chair of Care England as well, which is one of the largest trade associations for the care sector, as well as chair of Championing Social Care, which is an initiative that a number of us volunteers come together to organise events such as Care Open Week, Care Sector's Got Talent, and the Care Sector Fundraising Ball, which comes up on the 24th of September. And we've got other initiatives that we're lining up to continue to unite the sector and really shine a light on social care, all the great and good that goes on in there. So that's a bit about me.
Thanks, Avnish. Okay, Sarnjeet, in terms of over to you, what are, from Agincare, from your perspective, introduce yourself and talk about what you do.
So yes, hello everyone, I'm Sarnjeet Banwait. I'm fairly new to Agincare Group from April this year. So I'm the Managing Director of Agincare Enable, which is a new division of the Agincare Groups, and we work with working age adults with learning disability and have autism and physical needs. So quite small right now, and we've got lots of plans in terms of growth and supporting some of the demand across the country for people and commissioners that have those kind of needs, and yeah, just slowly working across with our stakeholders.
Thank you for that. Rob, over to you from your perspective. A brief introduction, please.
Hi, good afternoon. So I'm Rob Martin. I'm the Managing Director for Care Services with Agincare. So we have 114 care homes that span from the northeast of England all the way to the southwest. We cover most local authority areas, and we are currently undergoing an expansion programme. So we've got another 13 care homes lined up, either to come across to be part of Agincare or we'll be commissioning in the next few months.
So you've got a busy time ahead here, Rob, in terms of you're very busy. So just a bit more about myself. As I say, I'm CEO for Homestead. We've got 245 locations across the UK, one of the largest home care providers. I also sit on the board of Care Workers Charity, which is dear to my heart. I'm also trustee of Age UK, and trustee and chair of Silverline as well, which is helping the older people. And I also sit on the board of the Home Care Association and the TSA. So I do a lot to try and support the sector wherever I can. But today what we're discussing is obviously about our care workers, which are fundamental and the lifeblood to all of our businesses and whichever type of business we are. And we've got some challenges, and we're going to have this, guys, in terms of those who are listening in. We're going to try and make this as conversationally as we possibly can and bounce ideas off each other, because you've heard we've got a different experience around the virtual table. So, and there's some challenges that face us all. Obviously, we've got the cost of living, we're up to with COVID, some LA funding, retention and recruitment, to name but a few. So, Avnish, probably if I can come to you first, in terms of you've got breadth of experience, loads of experience there. What are the particular challenges you're facing with the workforce, and what we're doing to combat it from your perspective?
Yeah, no, thanks, Martin. And I think this probably reflects most of the sector that, last 3 years now has been really, really challenging. We had all the issues around COVID to deal with, things that we'd never, ever dealt with before. And so that's been well kind of rehearsed. And as we came out of COVID, and this year, we found that the team issues were the worst they've ever been. It made our issues through COVID actually seem fairly easy, because at that time we could actually recruit because people were being laid off in other sectors, and it wasn't a problem to actually find team members. We had other issues, but finding team wasn't so much of an issue. This year, I think we had the worst crisis for team that we've ever had. And my senior team was saying it's absolutely dire. And then on top of that, we're trying to grow occupancy because of obviously all the issues that happened during COVID. So we had a massive issue to deal with. An agency was creeping up and up and up, which isn't good for care and isn't good for the finances of the home as well, especially when you're coming out of COVID and trying to grow occupancy and for team morale and everything else. So we had a long, hard think about what is it that we need to do? How are we going to move the homes forward? How are we going to come out of COVID and all the issues about people being tired, exhausted, people coming out of the sector being lured into supermarkets and into restaurants and everywhere else where they're getting an Amazon, where they're getting golden hellos and so on and so forth. So we had a long, hard think and said, right, if we set a target for occupancy, which we did, what do we need to do to make that a reality? And the key thing was recruitment and obviously retention. How do you make sure people don't go out the back door? How do you get people through the front door? And so we've done a whole raft of work that's ongoing. And some of that was around how do we ensure that recruitment happens? So it wasn't that there wasn't enough people, it's just that we didn't have enough resources for recruitment, because we pride ourselves in the quality of the care we deliver, the facilities that we have. We should have a queue of people lining up to want to work for us, even though there's less people in the market. So what we realized was that the care homes themselves had so many things to do. Recruitment wasn't always number one on their priority list. So what we did, we hired people to hire people. So we brought in additional resources to help the care homes take the pressure off. And we found a huge increase in our ability to recruit at a pace, which is what we've been doing over the last 6 months. And that's and then the quality of the people that we've managed to recruit as well has really improved there as well. So that's allowed us to grow occupancy. It's allowed us to make sure that agency remains at a minimum. Now we have a few areas where it's been more difficult and therefore we've had to work harder. So that's just one, and I've got others that I'll share later, but I wanted to get the rest of the panel to have some sessions, some time as well. But that's one area that we really focused on, was that to hire people, we needed more people to hire them.
It's interesting, and I'll probably bring Rob in next, but it's interesting, Avnish, in terms of what you're saying there. It was the same in home care. Obviously, during COVID, very, very challenging times, but we did manage to recruit. And then coming out, as you said, a lot of my guys in the ground and seeing saying this is the worst time ever, because we had a problem with recruitment, we had a problem with people who had COVID and then holidays and what have you. All the perfect storm seemed to happen as you did. And exactly like you did, we started to get some professional recruiters to really help us and professionalize what we did, so we could actually deliver the great quality care that we do. So it's funny, different settings, but same challenges. Rob, I know you wanted to come in there. What did you feel?
Well, I mean, obviously, before we get to the sort of solution side of it, I was really interested in what the causal factors were. What was creating this sudden surge or problem immediately following COVID, or the core part of the pandemic. And certainly the things that I've been hearing is clearly there's some obvious stuff like the delay in coming out of the EU has had some form of impact on our ability to recruit some of the European workforce that we come to rely upon. The other factor that I've noted more recently and very relevant to this discussion and right now is the continuation of use of face masks. Again, it distinguishes us from the rest of the sector and other workforce areas. So in terms of hospitality and other areas and other businesses, it's a lot of people are making the determination to step away from social care because of that requirement to continue wearing a face mask, which does feel important to people, clearly. So it's understand some of those causal factors and understanding how we can, work with people through some of those challenges and work to come up with some solutions. I think certainly in terms of how we've identified this time and how things have moved forward, certainly the biggest thing we've noticed is that people are in a situation where we're seeing a stabilization in the care homes, so there's less turnover. That's starting to get back under control, and we're starting to know more people come and show an interest in roles with us. following what has been a very hard time. So we are seeing an improvement in things. I think moving to the real living wage has helped a great deal. It's certainly helped because of the hospitality industry putting up their pay rates and putting in more competitive offers to pull people across to work for them. So that's helped us a great deal as well. But yeah, I think understand the causes first and foremost, and working through some of those challenges, and then working towards what the solutions are. We're still on that journey. I think face masks, as I say, continue to be an issue, and I think that's one point that I would mention that we'll probably get into more detail later is the parity with the NHS pay and conditions. I think is a big factor, because we do, and we've always lost people to the NHS. This was a pre-COVID issue, and something that is close to my heart. That certainly, I think, when you look at the responsibilities within the role and what people do, I think it's really important that we seek to have a parity with the grading structure, pay and benefits that the NHS are able to offer. Now, there's no simple solution to that, because this then brings us onto the fair cost of care and everything else as well. But I clearly I don't want to head there right now, so I'll pass that back to you, Martin.
Thank you for that. We can discuss that probably at a later stage, Robert. Sarnjeet, in terms of anything you would like to add on that from Agincare's perspective?
Yes, I would. I mean, I think Rob talked about looking at the causes of why we're in the situation we are, and I think COVID does have a lot to do with it in terms of our teams continued, through those couple of years. They continued. Not only did they continue, they probably had to work harder than they ever had to. Our support workers, our managers, in situation which we've never ever had to address before. I believe from that there was a bit of people got burnt out. People actually got burnt out. Some of our sports staff got burnt out, and it didn't stop there. It didn't stop there, because after following that, we then had a shortage of people that wanted to work in our sector, which meant that the current people that did want to work again had to put more hours on, and we're still in that situation. So I think that's one of the reasons. And yes, the other sectors are able to attract those people because they want to do something different. But I do think that we are seeing some, I think we are, or we will start seeing people return, or a bit more retention. And being that is because what our sector offers, and this is probably going to the retention side, what our sector offers in terms of that reward and the feel of job satisfaction, I don't believe you can get that the same level in the other sector. So I think we are not in a great situation, but we've got a lot to play for in terms of going forward. And everything goes up and down. We're at the down bit in terms of our crisis right now regarding workforce, but I do believe that when whatever goes down, it's going to go up afterwards. So I'm feeling quite optimistic about it. It is not great, but everybody is doing their best to turn things around, and I believe that they will. But we can talk about the retention side of things and what organisations are doing as part of that.
I think it's a great point, real good point, and I think, I don't know about you guys, and again, chip in, in terms of from our side, we are seeing a lot of green shoots over the last 4 to 6 weeks, particularly in terms of the recruitment. And as we start to probably fish in other ponds that maybe we didn't fish in before, to get our home care workers and how we can keep them. I think, Sarnjeet, you made a really good point in terms of the retention perspective, because our workers, we've got a lot of lone workers, obviously, of what home care is. So how you keep those people engaged, we've had to think more intuitively, but we get tech enabled a lot more than we ever did before COVID. So that's one thing that COVID forced us to do, and actually done a lot well. But I think the other thing we probably need to do as a sector, and this is just to throw it out there, and I don't know whether maybe we don't go down this rabbit hole now, but we probably do need to think about how our sector is perceived to people who are sitting on the couch. Because you're right, there's no better reward than working in what we do. We make a massive difference, don't we? So the people who sat at home, go and join care, work in retail, hospitality or leisure, we need to change the way we're perceived, maybe. I don't know whether that's...
Yeah, I think that comes from us, really. I think it comes from the people that have been in sector for so many years, and we're still here, and we're still, regardless of the challenges, we're still working, we still want to make a difference, in terms of our own journeys, our own experiences. I mean, there's so many people that can share that with those our next wave, the next generation of support workers, of why you would go into social care, health, because here we are, we're doing this job, and we're quite happy working in this sector, regardless of the challenges. I think we can do that piece of work, but we need to be doing it now because the demand's only increasing. We only need more and more people to come and join our sector than we ever did. So I think, I don't know how we go about that, but we do it in our own organizations in the way that we tell our own stories, our own experiences. And I do believe that in social care, it's probably one of the sectors where you can have the quickest career progression as well. There's more opportunities selling that, and also specializing as well. You can specialize. There's so many different ways of specializing in our industry as well. So there are different ways. It's just how we put that at the forefront of those people that we want to be our future workforce.
And we have talked about this. Sorry, Avnish, I'm going to bring you in now. We've talked about professionalising the workforce quite a lot, haven't we? So, you know, over the years, Avnish, sorry, I cut across you. Sorry.
No, that's fine. I was just going to add to that in terms of, I think, and I think, Rob, you mentioned it earlier, real living wage. That's the start of professionalising the workforce, because you can't have a professional workforce that don't get paid a real living wage in my eyes, because the whole term professional implies a certain level of remuneration. How can you be a professional and be paid below real living wage if that's the benchmark? And to me, to be honest with you, I think the real living wage, we became a real living wage provider across the board earlier this year. Last year we did it in England. This year we did it in Wales as well. And in some of our homes we pay way above that, and sometimes market conditions dictate that. So for me, I'm all in favour of that, because I think that just helps the whole cause. And in fact, over time, I think we're going to continue to see wage inflation to a point where I think, we'll get to a point where we can start saying really, truly that we have, care work is a professional profession. So that's a good thing. And I think the other thing that I just wanted to add in there is that organizations, we need to do more to empower our workforce, to make them feel valued, to give them the tools to do a great job, and to provide the environments and the culture and the leadership at the top, because people don't leave companies, they leave managers. So we're doing a lot of work around that, as well as the empowerment days, which you might have heard about, where we do all sorts of things like walk over glass, break boards, walk over coal, and so on.
I've heard about those. I've seen those on LinkedIn. They really look fantastic. Really
and what we're doing now is we're sheep dipping. That's not the right word, probably, but you know what I mean. The new people that join our organization, we have 2,500 team members. So every quarter we have around 200 new team members that will come to learn about the company, learn about the heritage, the culture, the values, the vision, the language we use, and so on. And I take a 3-hour session, and then there's a chap called Jermaine Harris who takes the afternoon session. And if you guys ever want to come along, we always invite people from outside organizations to come and see what we do. You're more than welcome to come and see that and experience it for yourselves as well. And that I think will help go a long way in that retention piece, making people feel valued, giving them insights and breakthroughs in their own life. Because one of our values is growth, not just growth of the company to get bigger, but growth of individuals. Yeah.
I think that's a great point. I suppose the challenge come back, Avnish, could it be from, please guys jump in, from the smaller providers maybe? Because I'm a big provider, we're probably all big providers on this call. Do you think it's more challenging for some of the smaller providers, either on the real living wage or some of those other aspects, that would prevent them doing these sort of things to really improve retention and make people want to stay within our sector and feel empowered?
Sorry,
go ahead.
So I was going to just add, I don't think that retention would be, I think it'd be easier for smaller providers in terms of, with it being smaller, people can kind of get to more services, homes, communication, feel valued, feel part of something. Because talking about, this, what Avnish was saying, that value piece is really, really important. And we've been working, some of us have been working virtually, especially, and we haven't had that contact with our teams, our services. Right now, that is more important, I think, more than ever, to see us senior people going to services, being face-to-face, and that communication, making them feel part of an organization. And I think the bigger the organization, sometimes more challenging that can be. But the smaller the organization, I think it's easier to get around, to be around, do whatever you need to do to talk to people and make those, you have to feel part of something. I think, you know, to want to stay, to want to retain in an organization, you have to feel a part of that. You can reach right to the top, you can communicate right to the top. And I think that's easier, I guess, the smaller you are than the bigger, even though we've got all this digital communication apps and everything. But I strongly believe that you cannot beat that face-to-face contact, especially when our support staff are face-to-face there supporting people. We need to replicate some of that for people to feel, you know, part of something which is bigger.
Yeah, feeling they're a part of something really special. And I think we can do that as a sector as well, can't we, to really get
That's
that.
right, yes.
Rob, you were going to come in, sorry.
Yeah, I'll just add to that. So I would say there are advantages and disadvantages on there to large organizations. And, you know, I could talk about the fact that we've got buying power, large resource tools. You know, we are more able to flex to these issues and work to these issues. I do worry for these one-off care homes and individual providers. There's much smaller providers out there. I think whilst there are absolutely some key advantages there for them, they really are going through a tough time right now. I mean, you know, when I think about utility costs and shopping costs and things like that, and the recruitment challenges they have, and added use of agency in some cases, I just think, how are they balancing the books? How are they managing to survive through this? I mean, as I said before, as a large organization, we have the buying power to go out and negotiate pretty decent deals with people, even in tough market conditions. But the one-off suppliers are less able to do that, and so they're much more impacted by some of these cost considerations. I fully expect we're going to see more of the 1 and 2 care home closures, particularly where they're older buildings. You know, that will cost, you know, cost more from a utility point of view, and cost more to run generally. I think we're going to see a lot more challenge on that front. So I do worry for the one-off providers.
Yeah, it's a great. I'd probably like to bring Avnish in there, probably with your Care England hat on now, Avnish, because you're probably close to this than probably most of us. You know, from Home Care Association, we haven't got those fixed costs, but we have got cost of petrol, etc., which is affecting a lot of our members from a home care association. So that's been a big challenge for us, and the general cost of living. But just think about what Rob just said then. What's your feeling on that across the people you speak to?
Yeah, no, absolutely. And Martin Green has done a number of press releases recently about the cost of you know, energy costs, for example, utility costs going up 600, 700, 800%. And that's colossal, alongside costs for food. And then also we've seen inflationary pressures on salaries as well. And you compound that all together, if you are reliant on a local authority who set the fee, if they don't commensurately increase fees to the right levels, we are going to see care providers struggling. I think we've seen that already. That's just going to go further as people come out of fixed term contracts on the energy costs. Insurance is going to continue to rise, no doubt. We've seen big pressures there. So, you know, these are real issues that, and I think providers need to really talk with local authorities, really get them to understand these pressures before they end up closing, because it's in no one's interest for good care providers to be closing, you know, taking capacity out of the market at this stage when, you know, who knows what kind of a winter crisis we're going to have, what kind of beds we're going to need to relieve hospitals and so on. We should be working, the health and social care sector should be working as one to ensure that we can come out of the last 2.5 years out of COVID and work collaboratively to ensure that, and I see this regularly. My mum was in hospital recently, and the number of ambulances all queuing up outside, there are not enough beds. Unless we work together, and that means we need capacity within the care sector, not lose capacity at this stage. But that requires funding and the joint up approach with local authorities, the NHS and the government, who ultimately are responsible for this, and the Department of Health and Social Care, to think as one. And that's the big challenge.
That's a really good point. And, you know, obviously we've got new Prime Minister, new Health Secretary, Social Care Secretary. So hopefully we'll see some changes. Sarnjeet, from your perspective, anything you want to
come in? So just on that point, because absolutely, I think we need to work together. And I think it's just, we've talked about NHS and, you know, the priorities there in terms of delayed appointments and, you know, people not getting the urgent care they need. Obviously, I feel that always takes priority in terms of the government's agenda. And that's what we've always seen, that the government's agenda, it's that's first, which is right. It should be, because that is the most urgent care. And then I think social care then kind of falls down kind of a bit lower on the list. And my kind of concerns are, even though, you know, as organizations are all kind of lobbying for the government to do something about the rate of pay in social care, and also the, you know, the long-term workforce kind of cost as well, and making sure our funding reflects that so we can pay our teams more. But I'm just interested to know how much, I don't know if anybody has, how much, what else we need to do to make sure that social care is higher on the agenda, something's actually done about it, and not done in the terms of something which we'll see the return of in 3, 4, 5 years time, but something which is maybe next year we'll see the impact of a decision that's been made now, and we can see the difference in the next year, because this issue is not going away. As I said earlier, the demand's only increasing. More and more people need our services, and it's, that part is a bit worrying in terms of concerning, if that's the right word, to see what more we can do as a sector to influence the government so that something is done, and it kind of is higher up on their list of priorities. I think that's where the change needs to be. We can do everything we can possibly can in terms of recruitment or retention, valuing our staff, but unless that part is changed, it's going to be still a struggle, still challenging. So I don't know if anybody has any views on that. What else can we do?
Can I
doing a wave of a hand thing there in the virtual background? So yeah, just to say that, you know, at Anchor we've been rallying for a Minister for Older People for quite some time now, when we renewed that call to the new government to look to put in place a Minister for Older People that would absolutely have this in the front and centre of their focus in the social care challenge that we're currently right in the middle of. And of course, you know, as we train our eyes towards the fair price for care and the changes that are set to happen next October, I think it's such an important time that we are heard, and the challenges being experienced right now are heard. I hear from people that it's likely that many social care providers will need to introduce mid-year uplifts, which is not typical of the sector, because of the challenges around cost at the moment. I think government needs to listen to that, because the challenge we've got at a time where they're working to align the public pay fee, the public fee for social care to the private fee rate. I can only see it widening right now. So this is a real problem that someone needs to grab a hold of and deal with urgently. So yeah, as I say, that's how we're approaching it from Anchor's perspective, to try and be heard.
Can I add to that, Rob? Some good points made there. And in terms of the Minister for Older People, I've been also, as my role as Chair of Care England, been banging the drums for that. And you know, so I think what would be good is if we could unite with one voice across the whole sector. So I'll pick that up with you, Rob, after, because that's been my mission for the last 2 or 3 years. The other thing I'd say is that I think sometimes the sector is not very good at coming together around some of these issues. It's always seen as somebody else will do it. I'll leave, you know, Care England to do it, or NCF or NCHA or whoever, or some other provider. If we want change, we've got to be that change. We've got to go and cause it. And I'll just give you a quick example of that. Many years ago, I was still a care operator in Cardiff, but we were concerned about the fees that were being offered by you know, the Cardiff Council at the time. So there was no form of ability to go and see them. So I created a Cardiff Care Homes Association. We got a load of providers together. We went and met the head of adult social care, lobbied them, and that year we had the highest increase of any Wales authority. And it could be a coincidence, but my guess is that it was because we put our case forward, we told them what we needed, and they went away and tried to help. And I'm not saying we'll be successful every time, but if we just sit on our backsides in our care homes thinking that it's just going to magically happen, it's not. we have to we have to go out there, fight our corner, show our case, and explain to the powers to be, this is what we need. And if we all galvanized and did that individually, collectively, I think we'd see more result. And I think the government, local authorities would sit up and listen, because they know that we are speaking with one voice.
Yeah, it's a good point, well made, Avnish, because I also have been banging on about Ministry for Older People as well. So, and I did take part in your campaign, Rob, as well. So I think Avnish has hit a real good point for me as well, because I do a lot on the thought leadership stages. No, Avnish and others do around this table. And I think sometimes disparate voices saying slightly different things kind of gives the government a get out of jail free card. So if I turn up talking about home care, then Avnish, you know, so there does to me something about being more collective as social care. And I know that Martin Green and Jane Townsend and you know, and Vic Rain would do a great job, but it's a lot of voices sometimes. And if you're a minister and you've got a lot of people to see, we need to probably make it easy for them. So there maybe is something out of this call, or something we need to reflect on, because we all work really hard in our jobs, being outward facing and trying to influence on the thought leadership and change government at either a local or a national level. And it's a good, could we be more collegiate? How could we pull together? Got two great, you've got NCF, you've got Home Care Association, you've got Caring, we've got some really good organisations in our sector. Fantastic, probably better than any sector I've ever been in. Value driven, great people, but probably more collegiate in terms of how we pull them across. So, I don't know.
Maybe that is it. Maybe that is it. You're right. We have got all these really strong, powerful organisations, and maybe they do need to come together. And we need to take advantage of the new people in the Parliament right now. You know, it's a new start. So maybe that's something we should actually consider outside this call, if something that would have more influence and impact.
Can I just add there, just so we're clear, because listeners or viewers will say, hang on, but there's the Care Providers Alliance. There is an umbrella body that sits above all the associations of which each of those member organisations belong to. Each year they elect somebody to manage that. I think Martin Green, I think from memory, is the chair of that Care Providers Alliance. So I will follow up with Martin on the conversation we're having today, in that each year then is that the person that is the representative that then goes to ministers and says, I represent all these organisations and the care providers sit beneath that. So for this year, I am your voice, you come to me. And that I think would answer some of the questions, because I do hear it from ministers and they say, well, you know, you've got three voices. 1 minute I'm talking to that person, then that person, and they use that as a way of sort of pretending that we're not united. Largely we are, and largely we are saying similar things, but they use that as a way of dividing us.
Yeah, and that Care Providers Alliance, it does sit there, and I think that's a really good call to use the chair, and it changes. So if you want a deep dive on home care, well, they talk to Jane Townsend, and that's absolutely fine, and that's the deep dive on home care. And there'll be certain things that home care would talk when it's not, but ultimately that gives them the presence, because I think it comes back to, for me, I don't think Joe Public understands social care. We know they don't understand social care. They think we're part of the health service, NHS. And I was speaking to Damien Green some time ago, and he was telling me, well, MPs just don't get letters that much about social care. They get loads about NHS. But they don't get Joe Public talking about social care. So we need to change the narrative and the lens social care is seen through, and not just seen through a negative way that it is oftenly by Panorama, but also from a positive way. And the massive difference, I think it was Rob and Avnish said before, unless we get social care right, the system will fall apart, you know, because we've got a big backlog in NHS, and we always have had. So it's working together, you know, collaboratively with the care continuum. And I think that's where social care really, really comes in, really does.
In terms of you know, what you're talking about there about the perception of social care, I think when we get onto solutions, one of the things, you know, if you go back a couple of years, 2 or 3 years now, I was really excited about the momentum and the pace it gathered behind social care in terms of the public perception pre-COVID, because I think it had grown so positively across using the social media platforms really well to celebrate and share stories of these open care homes that people would just drop in and visit. And events would happen, and you know, exciting stuff would happen, like pubs opening inside care homes and things like that, all these wonderful stories. And I feel like COVID's really put a stop to a lot of that in terms of we've been so focused on keeping people safe, and of course we've had to, for periods of time, close doors, and getting that traction going again in terms of the publicity and you know, that open door mindset about a care home being a welcome place that people can come and see. No one's got anything to hide. It's to be celebrated. There's some great stuff happens inside it from some amazing people. So using the social media channels to publicize that, I feel like we're starting to gather momentum on that front again. And I think that's one of the things we can control and we can do and continue to do, to just show what care homes are all about and what they actually do, and what a great job they do.
Yeah, and then don't forget, social care is not just care homes. So we also need we need to trumpet about home care as well. And as we go to the alliance, maybe it's not just about influencing; it should be really about the perception to general public and how we can start to change that narrative. That's, you know, so whether there's a social media campaign or something, I don't know, probably quite a few providers may be able to put some money where the mouth is behind that to really raise the awareness of social care, because we'll all benefit if we did that and change that narrative. We're kind of into the last 20 minutes or so, or 10 minutes, depends how long we want to continue this conversation for. So I suppose kind of turn to other challenges, and kind of Rob's alluded to it a couple of times. I'm going to come to you, Rob, and you've just, because you talked about it, talk about more, what have we done? What solutions have we come up with to come against any of these challenges that faces at the moment?
Yeah, absolutely. So if I get back to the care colleagues, people working within the social care space, particularly frontline colleagues, and some of the pressures that are facing them, I think some of the solutions that we've certainly come up with is, I've already mentioned pay, but I just wanted to get into rewards and benefits. And I know that Avnish has spoken a lot already as well about some of the things it does to retain good colleagues, and how, you know, his teams to be able to show that they're very much recognised for the great work they do. So one of the things we do is offer a reward gateway and a benefits package, as well as a support package. So we appreciate that working in care can be quite a tense and challenging role. And we also appreciate that for a lot of people working in care, right now, it's really hard to make ends meet. So we're working hard to try and find solutions to be able to support them, particularly through this winter. So as I say, that we do have a benefits package that we offer that includes things like shopping discounts and things like that. We should give a big shout out and mention to the blue light card, which is available for social care staff. Anybody, you know, one-off providers listening to this, or even large groups, should look to make sure that people know about this and can apply for a card with this, because it will save them substantially on the shopping, on the normal everyday week-to-week shopping. I think you get 10 to 15% discounts on most of the major supermarkets. So this makes a big difference. So it's things like that, making sure we signpost people to all the benefits and rewards. There's more specific things we're looking to do through this winter to support people. So we're going to be talking more about those in the coming weeks, but examples are things like whether or not we can offer something like additional shopping vouchers through the winter months, just to support people through that winter period. But these are all temporary measures whilst we wait to hear about the real living wage increases, which again, you know, we'll be looking to put in place at the appropriate point. But yeah, I think it's acknowledging first and foremost that it's going to be a very challenging winter for many, and to enable them to stay focused on their roles and continue to do the great work that they do, we've got to support them in any way we can.
Fantastic, thanks, Rob. Sarnjeet, you?
Yes, I think very similar. Agincare are doing very similar things to what Rob mentioned in terms of those benefits and support and guidance, but also linking people into, you know, what the government's doing in terms of supporting people in terms of like the energy kind of plans they have, that people with low income can actually access. So there's, and it gives the message to people that we, as your employer, want to provide you as much information, as many benefits, and make them as accessible as possible for you. And it gives that that we value you. We understand that, you know, our salaries aren't as high as some of the other sectors, but these are the other things that we can add to make your life as comfortable as possible. But also, I think we all always talk about induction, but as an organisation, we focus a lot of time on like welcome surveys and seeing people's journey into the organisation, making sure the inductions as thorough as possible, training and development, those things sometimes in the past we might have taken for granted, but I think there has to be so much more focus on those things right now to make sure that we get people to buy into the organisation, buy into the support that they're providing as well. So I think those kind of things probably more at the forefront, and we have a high on our agenda is our people project, and that is all about the rewards, the recognition, having events where you're thanking people, nominations, you know, just really shout outs to all the hard work, recognizing, acknowledging how difficult it is. Again, it goes back to that communication piece I was talking about earlier, just that communication with those team members that are at the front line in particular, but also I think our managers have had a really difficult time as well, and the same kind of attention and communication to those as well. That lots of things. It is going to be a difficult winter, and again with COVID as well. Yes, we're not hearing much about it, but with winter approaching, we don't know what that might bring in terms of you know, is it going to be another variant or whatever. I just think we need to be ahead of the game always, and again just sharing good practice with other providers. I think these are great forums to do that, but the other associations that we talked about as well to do that, because we're all in it together at the end of the day.
That's a great point. It is a great point. Avnish, do you want to, anything else you want to add on that point?
Just a tiny bit, because obviously we're doing a lot of the things that have been spoken about, so I don't want to repeat those. I think most providers kind of know what the right answers are, and I think we all are polarizing towards all those kind of initiatives to recruit and retain team members. I think a couple other bits to add is that one of the things that we've got better at over the last few years is talent management, is recruiting people from within the organization, not always looking to recruit from outside. We were too reliant on talent from outside, and we was often found a lack of alignment in values and understanding of the business, and team members would always struggle with people who came in from the outside and try to take the business in a different direction. So talent management is a big thing, and obviously just giving a plug for Care Workers Charity, and also we set up our own, or about to set up our own hardship grant. We have a rolling one anyway, where we find team members who fall on hard times, but the Care Workers Charity is there for those that do are really struggling, and as organizations, and I'm sure others are the same, we'll also make sure that where we find examples of real hardship, we go in and support. And I think that goes a long way when people within organizations are really looked after. That message spreads that this organization really cares about its people, and that's what it's really about, I think.
Yeah, that's a great point, and thank you for plugging the Care Workers Charity. So yeah, I would just like to add that, you know, for Homestead, not to reiterate what you guys have already done, because we do it, you know, also do very similar things, but we really focused on the well-being as the care workers as well, and the key players who are in the offices as much as we possibly can, and do well-being programs, sometimes remote through the office, virtually, or sometimes actually in the offices, and having the employee assistance program to help them in terms of financial planning, this sort of thing. Any problems they've got within their life, they get free coaching and support that's funded by OVE, and I think probably similar to what Avnish was just talking about there. And again, because yes, it's not just about rate of pay, it's a sense of belonging, it's a sense of wanting to be there, it's a sense of succession, and really valuing your career path with that organisation, and why they do it, because our people are very different, aren't they, in this sector than retail, hospitality, leisure. They're doing it because of passion to make a huge difference. So if I could probably wrap our session up, because I think we've got 10 minutes or so to go, what if I could come to you all about one thing in terms of what's your ask, or probably to the wider, or you could share with the people listening today, or when they listen back to this, what's the one thing you'd want them to take away that, you know, you could help and support the care workforce going through these challenging times? Rob, I'll come to you first, because you were the last one in.
Well, that was an incredibly complex question to answer, but put simply, professionalisation of the care workforce and a fair wage for a great job.
Well put. Sarnjeet?
I think that's probably the answer to all that. But adding on to that, I think just perseverance from the sector, perseverance from all of us, from the whole sector, that there will be an upside to all this, and that, you know, we need our people to stay and encourage more people to come into the sector. But I do think we will see better times ahead.
Yeah, I just want to add to that, making sure that the government don't interfere with the sector in a negative way, with all the cap and the white paper and all the things that potentially could ensue from that, that we really go in with our eyes wide open and we make sure that we preserve the social care sector with all the great and good that happens, and we make sure the government enhance what we do already rather than decimate it with all sorts of rules and regulations to try to curb and curtail the great care that we deliver, because what we don't want is a one-size-fits-all and homogenized service at the lowest cost, so people don't have choice.
Yeah, I think they're all fantastic points, and I think it's about choice. I think is a big one for me, giving people the choice of where they, and a lot of people who work in our sector have choice. They're here because they want to be here, and I think whether you're a small provider or a big provider, you know, everyone's got the choice to have a chance to have influence and get involved. I think we have all talked about this and influence those around us. Some great, not just the Care Workers Charity and NCF and different ones you can get involved with. You know, please play your part, because together we're stronger. I think we've all said that before. We need to work together. So I'll wrap the session up now, but I want to thank everyone for listening to and getting involved with the Professional Care Workers Week. It is absolutely critical to our sector, and because care workers are the heart of every single thing that we do and make a massive difference to people that we serve. So thank you very much and enjoy the rest of the webinars. Thank you.
Thank you.
Yeah,
Thank
thanks
you.
everyone.
Thank
Thanks.
you. Bye.